I'm Janne Boone-Heinonen. I'm an epidemiologist at Oregon Health and Science University, and I'm really happy to be here. I think this is such a fantastic program, and I'm glad to be a part of it. So I'm going to share just a tidbit within 5 minutes of my research, which focuses on obesity prevention, specifically as it pertains to obesity susceptibility that's passed from one generation to the next. So one area that I focus on is this idea of developmental programming of chronic disease. And you might have seen this in the media, fetal programming, fetal origins. It's the idea that as a result of adverse prenatal exposures, this could be maternal obesity, this could be environmental exposures, stress exposures, there's alterations to fetal development that then places this child at risk of disease and obesity throughout their life. Okay, so in the field, we're learning more and more about the biological mechanisms that take place and that give rise to these relationships, and where we have robust evidence that these relationships exist. What we know almost nothing about is how to fix it. So how can we sort of counteract these adverse alterations after they've occurred? So a body of work that we're working on in public health is to think about what aspects within the domain of public health, this is provision of healthy food, promoting healthy diets, promoting physical activity, might be able to counteract some of those adverse developmental alterations. Okay, and so what the goal is to start to move this trajectory, this adverse trajectory, closer to a normal trajectory. Okay, so I'll just show you one simple example just to illustrate how this might work. So what we have here, this is body mass index. These are adolescent girls. And then we have physical activity across the x-axis here. And we have this split out by different birth sizes. So low birth weight, normal birth weight, high birth weight. And what you see here is this red line. These are girls who were born heavy. They have much higher BMIs than the other groups, but only if they're sedentary, if they're not physically active. The higher physical activity you see, the closer those lines become. This is a very simple example, preliminary evidence of how this might work. So we have ongoing research in this area and are excited to move it forward. Okay, so what about students? I love involving students in my research. They're involved in almost all of my research, and I've just shown here some examples of projects that students have worked with me on. And what I most love about working with students is that they provide a unique perspective. So in all of these cases, the students interjected their own interests into my sort of core research area of obesity and diet and physical activity. This was a preventive medicine resident interested in cardiometabolic outcomes. I had a student interested in depression in rural women. Childhood maltreatment and its impact on obesity, body composition in newborns, and weight perception and weight stigma and its impacts on future obesity risk. So, I think students lend just a really rich sort of perspective on ongoing research, and we really value that. Okay, so as you embark on your first research experiences, you might wonder, what should I be doing? I think the most important thing to realize is that investigators take on students onto the research teams not because we think you know everything. We know that you don't know everything. We take you onto our research teams because we're excited to see you grow and develop. Okay, so how do you do that? What really makes us happy is that you actively grow. You take an active role in developing as a budding scientist. We like to see you ask lots of questions. We like to see you be excited about taking on something new that you might be a little nervous about. This is really important now and forevermore throughout your life. Seeking out, learning from, and acting upon feedback. So feedback is not criticism. Feedback is an opportunity to help you grow, to improve, and then to take the next step towards your goals. And some people are better than others at providing this feedback, and sometimes it feels like criticism. But just keep that in mind, and that will serve you well for the rest of your life, probably. Okay, and then also talking with your team members about their interests and career paths, so that you're at a point now where it's really important to really define your interests and where you want to go, and sort of set a path that might change. Okay, and then the second thing is to understand and really take seriously the contribution to the team. So we want to hear about your ideas. We want to hear about your questions. We also want you to understand your role. So, investigators spend a lot of time matching a student and their experiences with the needs of the research team. Okay, and so anything you do on a research team is important to the research team, and it's also important for your training and for taking the next step. Okay, and the last thing is defining your long-term goals and talking about that with your research investigator. Thinking about what do you want to get out of this experience, and then working with them to define short-term goals in order to achieve whatever you want to achieve by the end, and making sure you're keeping on track. Okay, so that's all the advice I have for today.
So on the one hand, I love following Dr. Boone-Heinonen because I can just say ditto, right, to what she said. On the other hand, I hate it because she's always so articulate and I feel like a bumbler in her wake. However, bumbling or not, I did want to follow up on something that I heard the person who introduced us say at the beginning, and that was to ask questions. One of the things that I think is really important about your education and your ability to be a competent and successful adult learner is to be courageous. And asking questions requires courage. And sometimes you feel like a dimwit, and sometimes you feel like the only one in the room who doesn't understand. And people will always tell you that if you ask one question, there are 5 people who were thinking the same thing who just didn't have the courage to ask it. I actually believe that that's true. So active learning requires courage. And it requires you to take the kind of feedback that Dr. Boone-Heinonen was referring to. So begin practicing now. Not this instant, but when the question opportunity comes, ask the questions that you want to ask, and really, truly, other people will have similar questions in their minds. And then you can role model for them how to do that, and people will feel safer and more able, more efficacious to ask questions in your wake. So that's probably all the feedback or the advice you're going to get from me in this talk, because I hadn't seen one of these previously, and now that I've seen Jan's, I would do mine differently, but this is what you're going to get. I'm Lynne Messer. I'm in the School of Community Health here at PSU. I also have a joint appointment, I think, up in Epi, and I'm an epidemiologist by training. Maybe that's what you need to know. Oh, good. Okay. So if many of you are looking at your personal path as what am I doing and how did I get here? I want to assure you to not worry. Many of us have taken some long and winding roads to arrive at the research careers at which we have landed. I don't know if I'm going to take the time exactly to go through every single one of these steps, except just briefly to say that I started at the University of Oregon with about 4 different declared undergraduate majors until I arrived at community health, which really was where I wanted to be. decided that a year of ski bumming was going to look like mogul mashing and doing jumps. And in fact, it looks like skiing backwards downhill in a wedge as you're trying to help children. So when it was a counselor for a while, ended up at the School of Public Health at UNC, where I got a Master's of Public Health. The Master's of Public Health in Health Behavior Health Education is very similar to the Master's of Public Health here in Health Promotion. There is a lot of similar and not similar. My Master's, there was a lot of focus on individual level determinants of health, and what I learned living in North Carolina is that there are a lot of factors outside of individuals' decision-making and individuals' desires that affect people's health. I learned a lot about racial and economic residential segregation. I learned a lot about white privilege, being a white woman living in the South. So all of those led me to want to go into social epidemiology, which is the study of how social structure and social influences affect people's health. And so I became a social epidemiologist, but also a reproductive perinatal epidemiologist. Hung out at the EPA for a while so I could add environment a little bit to what I was thinking about. And all of this culminated in being a disparities researcher. I focus on the social construction of health disparities, and I conduct most of the work that I do in the developmental origins of health and disease framework. So, long and winding, but ultimately pretty fun. All right, I think one of the tasks that I was supposed to do today was to discuss some of the projects that I currently have funded that may be accepting students in the years to come. And so that's what I've done. I just focused on three projects here that are currently funded that I would love to hear more from you about in the months and years to come. The first is a randomized control trial of a teen pregnancy intervention. I'm the evaluator epidemiologist on this study. We're just beginning baseline data collection. There is going to be boatloads of data and research opportunities associated with this project, and I think it's going to be a lot of fun. Right now it's kind of been a pain, a lot of IRB related action, but I think it's about to become fun. The second project is a social factors affecting birth outcome disparities project, and in which we, Dr. Richardson, Dr. Izumi, another faculty member in the School of Community Health, and I are looking at the intersection of nativity, documentation status, and residential conditions, and how those are associated with adverse pregnancy outcomes among Latinas living in the Portland area. And the third one, coming out of my EPA life, is the construction of an environmental quality index. I can talk forever about this, but we've constructed an environmental quality index for the county, and we are also constructing one for all 75,000 census tracts in the United States. So lots of really interesting data that allows us to look at environmental effects. Second to lastly, I also have one previously funded project that still has a lot of interesting opportunities, the recruitment and retention of HIV-positive women of color in HIV care. Finally, this could have been done better in retrospect, but I do want to say that I actually work and publish with undergraduates, master's students, and doctoral students. I, like Jan, am happy to accept students, I'm happy to work with students, and find that they bring a lot to the party. Again, you're not expected to know everything. You are, however, expected to be open-minded and willing to bring some energy. So I will look forward to hearing from you in the question and answer session now that I know that you're going to be all courageous. And thank you for the opportunity to tell you just the tiniest bit about what I do. Thank you.
Thank you very much. All right. As Jen gets set up, just offer another little thread connecting to our afternoon. As you're listening to the presenters, they could speak for hours, if not days, if not weeks, on the work that they're doing, the ways in which they've dedicated their lives. And they're presenting in 5 minutes. Sean, again, is dutifully letting them know when they have 3 minutes, 1 minute, 30 seconds. This is a version of their elevator pitch. So keep your antennas up for those kind of elevator pitch skills of what they're saying, how they're presenting it, the nuggets that they're offering to you to pique your curiosity about knowing more about their work. So just planting that seed of maybe hearing their words through ears that are thinking about your upcoming elevator pitches and the work that you're doing on that and will continue to do. Thank you very much.
So take their suggestions for brevity, not mine, because I'll go on and on. So be sure to keep me on task here. So this is really exciting, and congratulations and welcome to this really exciting program. Hope you still have some stamina left at the end of a long training week. But really excited to talk with you today. I'm Greg Townley. I'm in the Department of Psychology. I'm a clinical community psychologist. I imagine many of you probably know what a clinical psychologist is. So in my training in graduate school at the University of South Carolina, I saw people for individual therapy as well as group therapy. But I consider myself, my identity is more as a community psychologist. So I examine how environmental factors impact personal and collective well-being, specifically for people who have psychiatric disabilities and histories of homelessness. When I say psychiatric disability, I mean conditions that usually are fairly pervasive and require often treatment either with medication or with social support type of things like peer support that I'll talk more about. And these are conditions ranging from schizophrenia to bipolar disorder to major depression, okay? A lot of my work is very much in line with this mantra from Pat Capone, who's a mental health consumer advocate, who would always say, home, a job, and a friend. It's more than just medication. People with mental illnesses want and need the same things that all people need. Things like a good place to live, somewhere to have stability and lay down roots, right? As well as a job, something meaningful to do during the day, and a good friend or someone to love. And so the research that I do, both locally and nationally, is aimed at understanding ways that we can increase these supportive factors for people who are struggling with these often very challenging conditions. A cluster of projects with Cascadia Behavioral Healthcare here in Portland, Oregon, examines their supportive housing units. These are typically congregate apartments where people live who all are experiencing mental illnesses and may or may not be engaged in service use. And these housing sites are ones that sometimes breed a lot of segregation and isolation. And so we wanted to find ways to make sure that people were getting the supports they needed from the mental health system, but also had opportunities to move around the community and do activities and identify activities that they needed through things like transportation networks, through having opportunities for job training, for education. So we evaluated their housing, made suggestions on ways to make them more integrated into the community, and learned that people really wanted to know their neighbors more. They knew people within the building, but they didn't know people outside of the building. And so we started this study just in May, the Neighborhood Attitudes About Supportive Housing study, where we're going to neighborhoods, knocking on doors, canvassing neighborhoods, handing out flyers, asking them to talk to us about their perceptions of the other housing types in their neighborhoods. Are they even, for example, aware that there's a housing site intended for people with mental illnesses? Because we believe that awareness will allow better linkages between people in the mental health supportive housing and people in the broader community, and help to diversify social networks for people who are experiencing mental health challenges. We also think if people have really negative attitudes, there are things that Cascadia may be able to do in terms of citing these housing buildings, in terms of reaching out to the neighborhood to challenge what's often called NIMBYism, not in my backyard. Another project is with Temple University Collaborative on Community Inclusion, where we're examining across the country. We're working in 15 different states with 25 different mental health service agencies to understand what are the individual and environmental factors that impact people's ability to participate broadly in their communities. And I use a lot of geospatial methods in my research, sometimes just for visually representing relationships, other times for assessing things like clustering of activities and locations where people are living. And these two maps, which are a little hard to see here, represent sense of community and community participation in urban and rural settings. The red dots are rural settings, blue dots are more urban settings, and we found if we couple this with statistics, we would find that sense of community and participation are higher in urban areas compared to rural areas, which inform our need to intervene in those rural areas to increase transportation networks and opportunities for folks who live there. And Lynne, I want to use your environmental index in this research. If it's available for use at some point, we'll chat further, because I think that would be it'd be awesome to see what aspects of the environment are more predictive of participation. We're looking at some weather patterns, but I think your metric would help us be more systematic about that. Another aspect of my research is in line with community-based participatory research, where individuals who are living experiences, in my case, working with people with mental illnesses and histories of homelessness, they're not only living the experience, but they're also engaging with us as partners in our research. They're not just taking our surveys, they're helping develop the surveys and the methodologies. They're co-leaders, co-producers of knowledge. Lynne and I are actually on a collaborative together with Central City Concern called HEARTH. It's Housing, Employment, and Recovery Together for Health. And one of the projects that we're just finishing up is a photo voice project. Folks heard of photo voice? So it's a method that combines, it comes from public health, and it combines grassroots social action with photography, where you essentially provide a camera to an individual, often of marginalized background, and ask them to take pictures that represent their daily lived experience in the community. So we worked with a team of individuals who use Central City Concern services. We formed a theme together from street to home, and individuals took pictures that both represented their either losing housing and becoming homeless, or their transitions out of homelessness. And the project, we recently had an exhibit opening, and these are a couple of the photographs here. One, Sam's picture of her former house and how emotional it was for her to revisit this area that she got priced out of as rental prices are ever increasing. It's a large cause of homelessness. As in this picture that Gary Cobb took, Yes in My Backyard, challenging this notion of NIMBYism, where he actually is a homeowner now, and he was talking about how transformative it is to be able to set up this essentially like an outdoor camp in his backyard where he can sleep, but he can sleep and feel safe. It's cathartic to him to reconnect with home ownership and the ability to choose how he structures his house and how he lives at his house. Anything else I want to say about this? I'll mention students were involved in this project in a variety of capacities. In some cases, it was helping us transcribe our interviews. In other cases, one of the students, Max, is actually an individual who experienced homelessness, and it's a student here at PSU. So his perspective was invaluable on this project. On the other projects I presented, students have been involved as data collectors, as canvassing, helping canvass the neighborhood to recruit participants. Sometimes these are paid roles, sometimes they're volunteer roles, but I love working with students, and we'll say a few more things about that. This is a team of students I worked with on a project with PAIR, which is a homeless service and advocacy organization here in Portland. We did a community mapping project and recently published this work. I've worked with students on their own McNair projects or other projects, and when I work with them, I think the other presenters have done an excellent job talking about some of the ways that we hope that students will engage with research. One that I'll add is that really you're a steward of the university and of the mission of Let Knowledge Serve the City. There have been terrible injustices enacted by researchers against marginalized communities. So we all have a role and responsibility in making sure that research not only does no harm, but more importantly, that it helps and it benefits and it has some sort of practical utility for people in the community. And you must understand that you are representing the university and a research team when you're working with communities. So be on time, be respectful, be culturally humble, and even if you're working with a group of people that share a social background as your own, know that you always have something to learn, and come in with the perspective of let me learn from you, not let me teach you. Let's see. And just know that the research that you're doing now doesn't necessarily mean it's the research you're going to be doing for your entire life. I know sometimes you want to find like the most razor sharp, like exact, precise kind of thing that you really love. It may be that you find a topic that's not as much of interest, but you're able to use a method that you really are jazzed about. So in my undergrad work, I worked on a project that was examining parental socialization of emotions. And I'm not really doing that type of work now, but that project, working on that team, helped me learn about qualitative methodology and cross-cultural research, which are certainly methods and philosophies that I still continue to use in my work now. Okay, so just an open-mindedness and appreciation, and be open and communicate with your mentor. We can't read your minds, and so please talk to us about what your needs are and what your hopes are. All right, thanks.
Aloha kako, kumusta kayo, amen. Good afternoon, or good morning. I'm Dr. Alma Trinidad, an associate professor in the School of Social Work. I can say associate professor now since I got my tenure promotion letter a couple weeks ago. So I want to begin my talk, my little short talk, with a little revised chant. E ala e ala e ala e. Rise, stand firm, stand. I begin with that because I guess I'm in a different space and I would do a traditional dominant way of presenting my research to date, but I'm going to sort of switch it around and tell you what this trajectory of being a scholar has been for me to sort of help you ground yourself in the work. Because when I look at everyone here around the room, it takes me back to my own undergraduate experience being a woman of color in Hawaii, a Pinai American. There's a lot of things that we go through, and I say we because we're a collective, as you partake in this journey. So here are some of the things that I hope to cover and sort of give you some of the ideas of work that I've done and some of the negotiation I've done along the way. So definitely place, because Hawaii is my home. Place and community being central to my work. Context, let it be the community context, the cultural context, and the community voices, let it be our youth, our children, and our families, how that really matters, and how the particular method that I've been using, particularly in the last couple of years of my profession and my career, has been community-based participatory action research, but indigenous and indigenized way of doing that. I recently realized that my role and my responsibility as a scholar is of this: Pinai, scholar, warrior of aloha. Pinai being Filipino American, and my upbringing as a Filipina on the island of Molokai. Woman warrior, having, I guess you can say, some background from a community that's been colonized, particularly by the Spaniards in the Philippines, and then living in Hawaii, a lot of my community members and the Kanaka Maoli being colonized by European and then the United States. How that sort of position encourages us to examine power and privilege. And in Pacific Islander traditions, women warriors always stood side by side with our men and other type of community members to stand firm, to utilize research and knowledge production as a way to highlight power and structure, but most importantly, hold on to some of the ideals and values of our community and to elevate our voices in the work of well-being and health. Aloha, which means love. In this stance, for me, holding on to that ethics of love, ethics of radical love for our community, for our people, and most importantly, our cultural values. So this sort of is the stance that I have been partaking, and I encourage you as emerging scholars to think about that and what you stand for in the work and how you engage with research, no matter what your discipline is. So a lot of what has been, thinking about my own career and my journey, this particular poem by Lao Tzu has always been in the back of my mind, sort of like a guiding principle or an oath that I partake. So it goes like this: go to the people, live among them, learn from them. Start with what they know, build on what they have. But of the best leader, when their task is accomplished, when their work is done, the people all remark, we have done it ourselves. So in this case, you can kind of see my space that I occupy as a scholar is with the people. Here, utilizing the knowledge that already exists and validating that and elevating that and making that central and making that count. I go back to the National Association of Social Work Code of Ethics as well. And I also encourage you as a scholar and emerging professional to think about the code of ethics that guide your work, because this is particularly important in terms of like seeing alignment in your work. So in my case, being a social worker, the context is very important. And seeing keywords here like well-being, living in poverty, and focusing on vulnerable, oppressed communities in the context of social and environmental forces. So a lot of my work has been that. And the other thing has been this particular framework, critical indigenous pedagogy of place. This has been sort of like the lens that I partake, let it be work with food security, working with youth voices in the community. These are some topic areas that I've researched. These are the three main ideas or concepts: analyzing power and privilege in the context of oppressive forces, indigenization, focusing on the voices of our community, and then lastly, engagement as a student, as a practitioner with the community. So I'll end here. I know there's going to be a lot of questions and answers for all of us, but congratulations again in being part of, I call it a movement, because it's a movement to sort of elevate the knowledge and the values of our communities. Thank you.
Fantastic, thank you. Scholars, look at this. I don't even, you know where I'm going with this. You don't even have to hear me ask. Go ahead.
Hi, my name is Tamaya, and I have a question for Dr. Boney. Is that how you pronounce it? Boone? I'm sorry. So going back to your presentation, I saw the acronyms on your chart, and I was curious to know what those meant. And my second question for all of you is, as undergraduate students, what advice do you have for us to prepare for graduate school? Thank you.
So the acronyms behind people's names?
It was actually on the chart, and you had like the dotted lines. And
The birth weight, the LBW, and that was low birth weight, normal birth weight, high birth weight. So that I should have defined my terms. Always remember that. And I'm actually gonna pass on for the.
Good, thank you.
Or who wants it?
Let's see. I'm trying to think of novel things that you haven't maybe heard before. I mean, obviously getting involved in a research team is really helpful, and all of you will have the opportunity, and that can really position you well when you're creating a graduate school statement of purpose or letter of intent for why you want to join the school. Having that background, volunteer work, let's see, getting to know faculty, people who can write a letter of recommendation that is substantive and that reflects they know you, and it's not just they've had you for one class. Do things you're passionate about, find things you're interested in, but also know that you still have a lot more training, and so there'll be opportunities in graduate school to do that. Be intentional, and so don't just go to grad school because it's the thing you do after undergrad. I think a lot of the people I talk to who struggle in graduate school are those who feel like it's this linear path, and it's not linear, and as Lynne said, there are many winding roads that get you where you want to be. It's okay to take time off after graduate school and to be intentional, and that really creates a portfolio for you that reflects someone who's mature and who has a direction and a purpose, as opposed to someone who's just kind of being swept along by life. Life happens, but allow it to be something that you've crafted and that you've worked with someone to help you be meaningful about choices. I might have some other brainstorms, but let me pass this to Dr. Messer.
I think if I had one piece of advice, it would be the best graduate school applications are the ones that tell a story. And the story should be as compelling as it can. Now, you don't want to fabricate your life, right? But we each have an interesting story to tell about how we went from point A to point C. And the better that you understand your personal story and trajectory, and then can tell that story and explain why, yeah, man, those freshman grades, they weren't really good, but this is, and then you can tie that together about how you've grown and all of those things. The better you can tell the story of how you came to where you are and why you know this is the next critical step, the more compelling your application will be.
I would echo that as well. And I also encourage you to look at the graduate school's mission and their values and the type of work that they do to see if that type of alignment aligns with your own goals in life. You know, because like say, for example, for me, looking at what social justice is in social work and how schools, social works across the nation and world do it and how they frame research is also important to kind of think about. So alignment, goals, and see if that particular school is the one that would provide that space and that care for you to fly.
Hi, my name is Nick Glover, and I have a question for Dr. Townley. I don't know if you've ever heard of the Housing First projects they're doing in Canada and stuff. I was kind of wondering, when I moved here this August, I was looking for projects like that, and I didn't see a Housing First project. Is that something you feel that we could implement and be one of the first cities in the country to implement a Housing First project? And in general, how do Portlandians feel about homelessness?
Wow, these are big questions. I will try to address them, sure. So you mentioned Housing First. So Housing First is this notion that, I mean, it's not rocket science. Let's give people homes and magically they get better, right? So it was originally developed by Samson Barris in New York and then has been tested around the world at this point. I was an qualitative evaluator on the largest Housing First trial in Canada, across Canada in 5 Canadian cities, and we found that it had people who were housed in Housing First units as opposed to treatment as usual did better clinically in terms of health. They had longer housing stability, higher quality of life. They had more ability to find jobs and find social support networks. It's something with a really strong evidence base, but there are still challenges, some of these being philosophical or moral, the notion of giving someone a home and not requiring that they use services or not requiring that they be clean and sober and abstaining from drugs and alcohol can be met with a lot of resistance. So when I was in South Carolina, it was always an uphill battle trying to convince people of implementing Housing First for more of these moral or political reasons. For Portland, it's more of an issue. I think people are very much on board with the idea, and it becomes more of an issue of housing stock and availability. And it really requires being creative about how Housing First is implemented. And so the notion of like scatter site, fair market housing, which is what you're supposed to do, in Portland is quite hard. There are approaches like the Bud Clark Commons where we have a building, a congregate style of Housing First. All the values of Housing First are there, but less of the notion of scatter site housing. That I think has more of an ability in Portland. I think that Portland's a place where people are fairly supportive and understanding that homelessness is an issue, but there is still that judgment and that belief that it's an individual problem, result of having a mental illness, a result of having addictions or making poor life choices, when really it's about supportive housing availability. And that's what I think has to be part of the ongoing conversation. Right now we've seen a lot of uptick in the tent camping, which is a solution, but I don't think that it's the solution because it makes people believe that's all they need, that they don't deserve permanent housing. So I want to study the urban camping a lot more, but I have a lot of ambivalence about how it's currently being operated. I think it increases a lot of negative attitudes about homelessness rather than positive attitudes. Happy to talk more. Those are some of my beliefs that are both informed by my research as well as my own personal opinions about homelessness and Housing First. Were there other parts of your question that I didn't tap into? Right. There are evidence-based approaches. They have worked in a lot of cities, and I think Portland could benefit from having more Housing First used that's not currently in practice.
Music. Hi, my name's Ashley Tolbert, and I had a question for Dr. Boone. When you're studying obesity in women, are you looking at women that have suffered from obesity for a long period of time, or are you studying women that are obese at conception, or obesity that is part of the pregnancy? What are or maybe all of them, but.
So this is an example of how a fresh perspective can ask really good questions. So you're actually touching on some of the major gaps in our knowledge. Most of the research is on pre-pregnancy BMI, how heavy, was the woman right before pregnancy. We have evidence on how much weight is gained during pregnancy. There's hardly anything on what happens before, if she, was obese from childhood and on. Largely because of lack of data, it's difficult to follow women for that long period of time, and then also her children. But that's an excellent question. That needs more research.
Hi, my name is Carmen. My question is directed to Dr. Townley. I commend you for your research with patients that have mental disabilities, and you're transitioning them to homes. I'm kind of in the process of narrowing down my elevator pitch, and I was excited to hear what you're doing. Do you think that finding housing right away for a patient that I work for the Hawaii State Hospital for 11 years, and I was explaining to the group that I got fed up seeing patients getting released early for overcrowding and then coming back right away into the system, relapsing, and maybe even committing further crimes when they're out there because they were put on psychotropic meds right away, or they were stable when they went out but they came out very unstable. What would be your thoughts?
Yeah, I think it's an important issue, and there are a lot of barriers involved with hospital stays and the limits on hospital stays that require that people get released before they may be ready to be released. In some cases, they go to live with family members, many times who end up victimizing them. In some cases, they go to transitional housing or group homes, and those are really of varying quality. There's a theory, this competence press model, whereby individuals need a solution that is pressing them enough that it challenges them to grow, but also understands that they aren't going to come out of hospitals immediately ready, in all cases, to have independent housing and be able to know how to pay all their bills. And so we need solutions that usher people gradually. And I think peer support approaches, where you have people with lived experience who have been hospitalized themselves, who have the challenges, and are able to meet that person when they come out of the hospital and work with them around filling out a resume, applying for housing, and making sure that those supports are in place rather than just throwing them out. That's why deinstitutionalization didn't work, is because we threw people out of hospitals with the assumption that communities were going to take care of them. The communities didn't take care of them, and that's why we have many of the problems we have now. And so I absolutely agree that you can't it's not an on-off switch. It needs to be gradual, and it needs to be along a continuum with a variety of wraparound supports. Great, thanks.